Hello everyone, I am Zhiyu. I'm one of the internal medicine residents at the University of South Florida. Today, I would like to present a case with renal cell carcinoma with an uncommon initial presentation of optic disc edema. A 44-year-old gentleman was referred to our emergency room by his ophthalmologist because he was found to have bilateral optic disc edema. So neurology was involved. Patient was admitted to medicine service for further investigation of potential disorders which can cause increased intracranial pressure. Extensive neurological studies were performed, including CT head, MRI of the brain, MRV of the brain, and also lumbar puncture. The results of the above studies were non-significant. Patient also has a hypercalcemia level of 12.1, microcytic anemia of hemoglobin level 7.9, and also elevated ESR and CRP. Patient endorsed 35-pound unintended weight loss as well. At that time, we decided to proceed with potential malignancy screening with CT chest, abdomen, and pelvis with contrast. There is a 16 centimeter infiltrative mass arising from the upper pole of his left kidney, which was identified by the CAT scan. The biopsy was performed and the diagnosis of renal cell carcinoma was confirmed. Patient was discharged with outpatient oncology clinical visit, and the latest clinical visit report suggested patient was treated with axitinib and pembrolizumab. Optic disc edema is a very common clinical presentation with potential increased intracranial pressure. And renal cell carcinoma has an incidence of 13.3, mortality rate 3.5 per latest studies. Over half of patients with renal cell carcinoma were identified incidentally by imaging findings. So there were a few case reports published before suggesting that optic disc edema could be the initial presentations in patients with gastric, duodenal, and prostate cancer. However, very few case reports published before suggesting that optic disc edema is the initial presentation of renal cell carcinoma. As clinicians, it's very important for us to maintain high clinical suspicion when patients, like our patient, with negative findings in neurological studies, but patient has optic disc edema with typical features of malignancy, including significant unintended weight loss, anemia, hypercalcemia, or other paraneoplastic syndrome. So for conclusion, optic disc edema, a very common manifestation in intracranial diseases, could be the initial presentation of renal cell carcinoma, especially in patients with typical features of malignancy. So as clinicians, it's very important for us to maintain high clinical suspicion when patients present with optic disc edema with typical features of malignancy like weight loss, anemia, and hypercalcemia. And at that time, the screening imaging studies for detecting malignancy could be indicated because the early diagnosis and identification of cancers affect significantly in the prognosis, in the perspective of prognosis and mortality rate. Thank you for listening to my presentation.